Tonight, as Ghana's coronavirus case count jumps to 1,154, it is emerging we lack the capacity to provide real-time, hourly, or even daily updates on our COVID-19 figures.
We have 30 million population here. We expect that about 10% of the population may be infected.
Is that our projection?
Yes, we have that projection.
Now, this is not this is what we projected.
It's not hypothesis. 10% may become positive.
And I gave a hypothesis, which is a hypothesis that WHO put out.
Plus, we'll dig into that controversy tonight, probing the gaps in communication on the coronavirus crisis following the controversy over government's projected figures of deaths and infections from the coronavirus.
This is Top Story with Evans Mensah.
And Top Story is always brought to you by Bond Savings and Loans. Your success, our passion, is also brought to you by Gas and Cement, the nation builder. And Vodafone, the future is exciting. Ready. With our case count when it comes to the coronavirus pandemic, now having jumped suddenly from 1,042 to 1,154 cases just in the last 2 days, you're now learning that Ghana actually lacks the capacity to do hourly or even daily tests in real time to be updated on the website of the Ghana Health Service, which has become the reference point for the authentic data on tests and everything COVID-19. This emerged today at a press briefing that was organized by the Information Minister and addressed by a number of experts, including the virologist from the Noguchi Memorial Institute, which indeed spelled out the difficulty with the hourly real-time updates that has been touted as much needed in this fight against COVID-19. We'll dig into that. And we'll also tell you, we got a sense of this from last night when we did an interview on PM Express last night with the Presidential Advisor on Health, Dr. Nsiasari. He will articulate what the challenges really are with the regular updates. Before we come to that, however, we need to deal with the several controversial issues that were addressed today at the press briefing this morning at the Information Ministry. Several controversial issues have emerged over the last few days when it comes to the accuracy of the reporting we are getting from government. We'll start tonight with the controversy surrounding whether or not we do as a country have the capacity to test the 80,000 plus people that we were told that we have tested. In fact, the president put the figure over 65,000 test results that have been received. Questions were raised about whether indeed we have the capacity to do that in this country. Well, today, for the very first time, we had a virologist from the Noguchi Memorial Institute addressing the press on the particular subject. I wanted to listen to Professor William Ampofo detail the capacity that we have as a country when it comes to testing.
These samples arrive at the lab, whether it is Kumasi or Noguchi or the VSD or the Public Health Reference Lab. We go through a process to enable us to utilize the reagents or the chemicals in a very efficient manner. We simply pool the samples. What is pooling? Pooling just means that if you have 1,000 samples, you put them in pools of 10, and therefore you test at a time 100 pools. So in a short time, instead of testing only 1,000 samples, you actually test 10,000 samples. This simple arithmetic is what some people cannot do. So as we started, we realized that as the numbers grew, we were actually pooling 5 samples, and then we changed to a pooling of 10 samples. And this simple protocol was followed both by colleagues in KCCR and, of course, is now adopted by colleagues here at PHR and VSD. So in a nutshell, you can understand that it is not impossible to have tested 68,000 samples, as His Excellency the President reported when he addressed all of us. Actually, since he addressed us we have actually tested close to 30,000 samples, again, using the same method, because each time we do 10,000 samples, it's actually, a multiplication of a simple initial number. So please do not be surprised if in the next couple of days you hear that we have tested 100,000 samples in Ghana.
Now, there are several questions that this raises that we'll simply ask tonight. A lot of questions will be asked because we still have to reconcile a few things. Now, he says there, from what you heard, and that is a professor from the Noguchi Memorial Institute, that since the president addressed the nation on Sunday, they have actually tested 30,000, they've done 30,000 tests over 2 days. That's an average of 15,000 tests a day. And he explains that, of course, this was done within the short period, right? And so 15,000 tests was done on Monday, 15,000 on Tuesday. I mean, a total of 30,000 in a space of 2 days. That is huge capacity. In fact, if you listen. And then he explains, really, I'm sure you heard, about the pooling. I will not pretend to understand exactly how that reflects in our ability to test so many, 30,000 in 2 days. I won't pretend to understand the technicalities of the pooling and how that then allows you to do that much test. But it's simple to understand what he says at the end. The conclusion is that, well, I can tell you that in 2 days we've done 30,000, 15,000 a day translates to. But just last week, my colleague Fred Smith spoke to the director of the Noguchi Memorial Institute, right? And he's the boss there. He's the overall boss of the institute, Professor Kwabena Annan. In fact, Abraham Kwabena Annan. He's the director of the Noguchi. Now, listen to what he says about Noguchi's capacity, testing capacity, when Fred Smith spoke to him last week.
As at now, we have situations where in a day we are testing 2,000 to 3,000 samples a day. And this is far even beyond what we said Noguchi will do earlier times. We've been able to do this because we have mobilized, because this institute has resources in terms of human capacity, scientific capacity, and also infrastructural capacity.
So they have capacity. The upper limit of tests, he says, the capacity comes down to is 3,000 a day. That is in pure language. But let's factor in what the pooling does. Maybe that is what then manages to get the real capacity of 3,000 to exponentially jump a day from 3,000 a day, the capacity, to 15,000 a day. There's something that needs to be reconciled there, definitely. The technical breakdown needs to happen because the boss of the Noguchi Institute says our capacity is 3,000 a day. That's the upper limit, right? But we heard the virologist who spoke today, at the press briefing today, Professor William Ampofo, detail how they've done 30,000 tests in 2 days. That needs to be reconciled. It's one of the questions we have. How do you reconcile that, the capacity, as we've been told, the 3,000, and what they've actually done, as we're told today, over 2 days since the president spoke? So a lot that still needs to be explained when you reconcile those two positions from two people from the same institute on that. Factoring what the pooling really is, if you understand what that is. Maybe that explains it. Now, that's the first controversy and the questions we have on that about the testing capacity. Let's move on to the second major plank of controversy, and this has to do with whether or not we can trust the number of tests that we are reporting. The Ghana Health Service is reporting on his website, and the president has been articulating over the period, including his last speech. I'm sure you've heard the concerns about that the figures that have been published includes duplicates, and that if you take away the duplicates formula, you might not actually have the 65,000 plus tests that we are using as a basis for the decisions we are taking, that it could probably be less, and that it probably would not be, again, will pose a challenge to the assertion that probably we are the best in testing on the continent. That has been a major controversy as far as this is concerned. Now, that was also addressed by Professor William Ampofo of the Noguchi Memorial Institute today. So it comes down to the question. The figures that the president talked about as in the number of tests that Ghana has done over the period, does it include duplicate tests, as in one person tested 2, 3, 4 times? That has all been added to say that's the number of tests that we've done? Or you call it repeated tests? Or it just individual tests for individuals that have happened? Listen to the answer to that question that Professor Ampofo provides today.
The number of samples is approximately equal to the number of tests that are reported. There has been some discussion about the retesting for the recoveries. Recoveries we have right now is 120 people. If those people have been tested 4 times, that's 480 samples or 480 tests. So the retests are insignificant compared to the total number of tests that we've done. And actually, we have a separate database for those who have been retested. So when we provide the cumulative figures to the Ghana Health Service, it excludes those who have been retested. So I think this point should be made clear that the retesting does not affect the data that is reported. And yes, what Ghana Health Service is reporting is the number of individuals who are tested. So what you get from Ghana Health Service is the individual, that particular person's results. But of course, in medical science, we don't put a name to a result. You get a test result. But these are test results of individuals, and they are not just samples.
That is a very important clarification. It is, so the numbers you're hearing from the government, 65,000 plus results that we've tested, he's clarifying that it doesn't include duplicates, doesn't include retesting. These are, the reporting is the, it says what GHS is reporting is the number of individuals that have been tested. It excludes retesting, or what I've called it duplicate. It excludes that. So the 65,000 plus test results that we have so far had the president announce, and he did announce it on Sunday, should not include duplicates. Now, the reason why that is important is that I asked this question of the presidential advisor on health, Dr. Insiasari, yesterday, about whether or not the president's figure that he puts out on Sunday, 65,000 plus tests, does it include duplicates? Listen to his answer.
Out of the 68,591 cases, are these individual single tests per person, or it includes duplicate tests for individuals?
It includes duplicate tests.
Okay, but if you reconcile that with the Noguchi, it gives you a dichotomy there. It gives you a divergence of facts. One says it does include, the other says it doesn't. And let's take the latest information. The latest information is what we got this morning, and so it doesn't include it. And so what we're reporting, what the Ghana Health Service is reporting, and what Noguchi gives them does not include the duplicates. But that's what the presidential advisor told us. And by the way, that's a short clip. To be fair to him, I want to play the entire block when it comes to that interview on this very controversial subject, because it really goes to, can we trust the numbers, right? Can we trust the numbers? And he attempted to deal with that comprehensively. So I'm going to play in full, without editing that block, what his answers were on this subject of the testing figures, including duplicate tests. Listen to Dr. Isiansari. By the way, he's a presidential advisor on health.
It includes duplicate tests, because as I said, when somebody is tested and is isolated and being treated, after 14 days, we do a second test. The person can be positive. If it's positive, it's still counted as a test. So we don't count the individuals, we count number of tests.
Okay.
So what is that? The number of patients will definitely be less than the number of tests.
So just to break it down so that we understand, what it means is that if Evans Mensah tests today positive, you test me again. In fact, you test because we had cases where people test negative.
Yes.
You test them again, they turn positive.
It's likely.
It's
because
possible.
if you catch them early.
Yeah, exactly.
It's not about 3 to 4 days.
And then to clear you do 2 tests.
2 tests.
So it's possible that for Evans Mensah, you might have tested me 4 times.
Yes. So
right?
you count it among the 68.
So it will be, in counting it, you say 4 tests, not 1 test. for Evans Mensah?
Yes, those that we do the repeat test to test negative, they use the same code number.
But when we are inputting it into the national testing figures,
we clean it. So we batch them together that he has been tested before.
Okay. So if this number includes the duplicates, I remember that you're doing your percentages for the number of infections, number of positive infections from that number. That can give you a false percentage figure.
No, that's what I said. Maybe I have to come back and tell you. What you do is that if the person tested at the same place and the test was done in such a way that there was no change in name and change in code number, there are some people who have gone around testing about 2 or 3 times that I tested here but I forgot, I'm going to test again. But if you test Evans Mensah and you are giving code number, for example, Noguchi gives NOVCO-2009- so and so number, you keep that, especially those who are under treatment. So you use the same code number for the person.
My question is, the 68,591 tests that we've done, it doesn't mean that we've tested 68,591 people. Correct?
Yes, it can be. Okay. It can be that way. Yeah.
In fact, that's what it is. That's what it is.
May mean that.
What it means is that we have tested less than that in terms of individual cases.
Yeah, but it's very few. It's only those maybe who are positive who will be tested 2 more times. Those who are negative, test once. But unless
the reason why this question
tested.
Science. This is why this question is important. Is in calculating your percentage, 1.5% positive.
Yes.
From this, that 1.5 positive, which many look and they say, yeah, if that's the case, then it's okay to lift. If you actually do the individual tests and that's what you use, that number could change.
It may be lower. But it means that
it could change.
It means that if the person was tested twice and we took it as twice positive, but we would have asked as only one person positive. It means there will be less people who are tested positive.
Yes.
But there will be more tests. The test will remain the same.
No, the test could go down.
No, the test may be the same because
the test will definitely go down.
No, you are doing tests.
If you're just doing the test.
You are doing tests.
Yeah.
So you do the tests, and then when you finish the tests, and there are more, maybe one person has tested positive twice, and you are counting it as a person. It means that the number of positivity will go down, but not the test.
Why don't we just use individual tests instead of the duplicate tests?
No, I mean, don't get us dwell too much on
No, but that is important.
Because the problem is that...
Because you see, the president said, for example, that we are leading on the continent when it comes to testing, right? And you used that to say we've tested 68,000 per population. But that includes duplicate tests. I mean, so that then, if you disaggregate the numbers, could pose a challenge.
No, we've done tests. That's the most important thing. Every test that you do comes with a cost. So if I'm the manager and I'm buying test kits, I buy test kits and I know that if somebody is positive, I'll test 3 times to declare the person recovered. So when I'm counting the number of tests that I've done, I'll count the number of tests that I've done. But when I'm disaggregating, then I'll take the individual because they will have the same test kit code. But the number of tests that I've done is actually the cost of the reagents and the cost of...
So at what point do you disaggregate then?
It's when it comes to Ghana Health Service, they disaggregate it to make sure that the testing which are done...
But you don't think in communicating to the public, you need to give us that information too?
Yeah, that's what I'm telling you now.
But we should have known before.
That's what I'm telling you now.
In the interest of being candid and honest. Remember that. Listen to the way you started this whole campaign.
Yes.
You promised us honesty, data. So you introduced briefings. So this is definitely a fundamental piece of data that we need to know.
That's why I'm giving you the data. Don't discount the number of tests you've done in this country. Don't discount the number of tests you've done in this country. We are testing, and we are testing. There are some cases that they have. There was one country where they have so many positive. You are the only African country which have not had positive. So yes,
because we don't test.
Because I haven't tested. Because I don't have money to buy any test. But we are investing in testing. So the number of people that we test, or the number of tests that we do, is is very important. It's very important. But from your analogy, if you are looking at the negative cases or the positive cases, it means maybe somebody who tested positive and is retested again will be another positive. But that person is counted twice as positive. It even will increase the number of percentage of positivity. So that one is the science which even makes it even easier, that even though maybe the 1.5 may be even lower positivity than what we are talking about. But if you, I know where you are coming from, because I have heard people who are saying that we cannot do that number of tests.
Can we?
Yes, because...
What is the capacity of, I mean, just to clear this before we go, because of the interest in the public in the actual scientific data. Henceforth, you said now that you're now telling us about this disaggregation. Henceforth, going forward, will there be a regular part of the briefing so we know the real actual numbers?
We can disaggregate it and tell you the number of the people who have been tested on the first occasion, second occasion, third occasion, or maybe fourth occasion. You can do that. We have all the data there.
So that is a full block there on this very controversial subject from yesterday. Of course, we've heard today from Noguchi explaining that in effect the figures that are published are individual tests and doesn't include the repeated test. Although the point has been made, and I think Dr. Mensah also confirms it, that they have the disaggregated figures there. Noguchi also said that what they give to Ghana Health Service to publish doesn't include the repeated tests. And so the question is, and I asked him that question, are we entitled as citizens and the public to get all the facts, including the disaggregation that Noguchi does, so that when it's been published on the website, we don't only get the 65,000 plus, but then we also get to know this figure, how many of that amounts to repeated tests, so people can form their own opinions and follow the official figures, knowing and having the benefit of the entire set of facts. We'll be speaking to a researcher, scientist, a virologist on the importance of the depth and importance of data in dealing with such public health emergencies on this particular subject. The reason why this particular controversy is important. Also to note the earlier controversy surrounding the testing capacity, and Professor Welamanpofo making the point that since Sunday when the president spoke, they've tested 30,000. They've done 30,000 tests, close to that. If you include the other testing centers, KCCR and the others that are coming on board, if you add all their capacities to, we know, as we indicated, Noguchi's boss says their capacity is 3,000. We also know from yesterday, the KCCR also said their capacity is 800 a day, right? I mean, and as we've heard already from the prof, from the Noguchi, even if you are considering it within the global scope of all the testing centers, they've done 30,000, and you disaggregate to the actual testing capacity of Noguchi 3,000 and KCCL 800 and the others, the question still remains, how are they able, with that capacity, to test close to 30,000 people in 2 days? He explains there's pooling there. What does the pooling really mean in real terms for mere mortals like ourselves? This is important, so the public can trust the data once they understand in simple language. We'll try and get the virologists to explain that for us from KCCR. There's a third controversy, and I guess this was a big one that got many people really scared last night after PM Express, which is the projection that Dr. Chansari announced, that Ghana is projecting that 3 million people will be infected. Out of that, 150,000 will be critically ill, and out of that, 15,000 will die. I mean, he put that in percentages. So 10% of the population will get infected. Out of that 10%, 5% will get critically ill, and then 10% will die. He put that yesterday. Today, he explained that particular projection that he put forward. I wanted to first listen to his latest explanation on this particular projection. What he said. He says it's a WHO one that he was talking about and not a Ghana one. will look at that closely. Listen to him today.
Yes, yesterday I was at Joy TV and I gave a hypothesis, which is a hypothesis that WHO put out, which is based on population of the country. And that's a hypothesis I gave, that if Ghana stayed without doing anything at all, that's what will happen to us as a country. That's the 10% of the population being infected and 20% of them getting sick and about 5% of them getting very seriously ill. But I said, and I'm sure they should have quoted me on that, that is not the case in Africa. If I base on the facts and the data that we have realized that our actual figures are far below what WHO has quoted. And it's because when we saw the WHO hypothesis, we were a bit scared. So we put a lot of things in place, which the Honorable Minister have mentioned, especially the preventive etiquette, which has become a new normal in this country, social distancing, ban on social gatherings, and also ban on limitation on or restriction on coming into the country, because we realized that most of the problems that we have in this country were imported. So after doing all these things, and then also we restricted movement in 2 of our great metropolis to get the data that we are using now. So from seeing the data, it has shown clearly that in Ghana, we will not go in that direction. And luckily, His Excellency the President has even added more measures, like wearing masks, where everybody here is wearing masks. Because if you wear the mask and you go out, and your brother and your sister is wearing masks, you don't bring the disease home. As we have already been saying, the virus has no legs. It's human beings who carry the virus. So I want to just make it very short, that it's not true that Ghana will have 3 million people infected before we reach the peak.
So it's not true that Ghana will have that. But did he have the clarity and opportunity to put this within the Ghana context yesterday when we spoke? Just to be fair to him and to be fair to everybody else who listened and watched. He got opportunity. He was asked the question, is this Ghana-specific modeling? Is this hypothesis? He's made the point today that this is hypothesis, but did he have the opportunity to state that categorically yesterday? Listen to the entire block on this as it played out on PMS last night.
We expect to see that the positives may go somewhere, but it's like a bushfire. So the bushfires will be quenched. If you allow bushfires to become very big, it's difficult to contain it. So we have plans for containment, and the plan for containment is to look out, pick everybody who is coming in.
That plan for containment, how many is based on how many projected cases?
You see, if you have the population is such that we have 30 million population here, we expect that about 10% of the population may be infected. And out of the 10% of the population,
so is that our projection?
Yes, we have that projection.
Okay.
Out of the 10%,
so no, I'm just hoping that this is not hypothesis. This is what we projected.
It's not hypothesis. That's what.
So Ghana is projecting that 10% of the 30 million population will be infected.
I'm coming. 10% may become positive, but out of the 10%, 80% of them may not show any signs and symptoms at all.
So that is our projection.
And 5% of them will be very ill.
Okay.
That's the projection. So
let me break it down. This is important.
That's the reason why
I'm just hearing this for the first time, so it's important just to break it down.
Yes.
Our projection, our modeling says we expect 10% of the population to be infected, positive. 80% of them will not be critical.
Yes, that's the projection.
5% will get critical.
Yes.
How many do you expect to die?
If you look at it, I think about 5%, the 5% who get critical, about 10% of them will die. That's how it is. That's how the modeling is.
So
that's how the modeling is.
Okay.
So, but because what we have seen in Ghana, and for that matter in Africa, that this modeling will not even be the case in Africa, because we are not seeing critical cases. And I've given you the reason And if you look at the cases that you are seeing, the number of people who are in critical condition is very, very small.
Yeah.
Even out of the 1,042 that you had, or those who have symptoms of 380, 4 of them, sometimes 2, 9 of them unfortunately have lost their lives. So it means we have a situation where this hypothesis may not be the case in Ghana.
But you are preparing
But we are preparing for this.
Okay.
And because we are preparing for this, that's the reason why we have opened up, get more testing areas, so that we follow what WHO has been saying, what other countries did, and then make sure that we also prevent